Hi, I'm Ashley, the pRTF Program Supervisor at LECOM Behavioral Health. Thank you for your dedication to helping children and adolescents in need of support. Today I want to share with you how our short-term psychiatric residential treatment facility, or pRTF, at the LECOM Medical Center and Behavioral Health Pavilion may be an appropriate option for some of the youth you support, as well as how the referral process works and positive results youth from our program often achieve. The LECOM Psychiatric Residential Treatment Facility in Erie, PA offers short-term care for youths ages 7 to 17. In an average 60-day stay, children and adolescents receive structured, compassionate treatment that bridges the gap between hospitalization and returning home while connecting families with supports they need for lasting success. At LECOM Behavioral Health, we believe every youth deserves care in a safe, supportive environment that helps them heal and grow. That's why we created our pRTF program. Here are some of the hallmarks of our program. Our pRTF is a 10-bed unit designed specifically for children and adolescents who need supervised, intensive behavioral health support. With just 10 spaces, each young person receives individualized attention in a setting that feels structured yet personal. Our staffing ratio is approximately 1 staff member for every 6 youth, with 24/7 supervision to ensure safety and consistent care are our top priorities. Plus, unlike many other similar programs, we are fortunate to have an abundance of psychiatric support from a child and adolescent psychiatrist and advanced practice professionals. While most other programs have provider support monthly, youth in our program receive weekly support and bi-weekly check-ins from psychiatric experts. Treatment is delivered in the least restrictive environment possible. This means while we maintain structure and safety, we also focus on creating a supportive atmosphere where children and teens can practice new skills, connect with others, and take steps toward recovery. Our team is dedicated to helping children and adolescents build resilience, strengthen relationships, and prepare for success beyond our doors. At LECOM Behavioral Health, we walk alongside families every step of the way. At the heart of the pRTF is a therapeutic framework built to help kids feel safe, supported, and understood. Therapeutic framework includes each day follows a structured and predictable routine, giving the kids consistency they need to feel secure. Our care is trauma-informed, meaning we recognize the impact of past experiences and create spaces for healing while giving youth a voice and choice in their treatment and daily activities. Care is delivered by a full team of experts, psychiatrists, therapists, and educational specialists working together to meet each child's unique needs. And when it's time to transition home, we overlap services and partner closely with community supports like family-based mental health teams so progress continues and families feel confident carrying skills forward. Daily programming includes each day at the pRTF is carefully designed to balance structure, growth, and connection. We use positive behavior supports, things like coaching, redirection, and reflection paired with reinforcement and fair consequences to guide youth toward healthier choices. Therapeutic and educational groups help build real-life skills. Children and teens practice coping strategies, problem-solving, mindfulness, and wellness activities that strengthen both mind and body, all while learning how to connect and interact with others in positive ways. And treatment planning is a team effort. Through goal setting and motivational approaches, you explore their values, identify what matters most to them, and whenever possible, families are invited to take part in the journey too.
Our pRTF provides the intensity, structure, and support necessary for real stabilization for growth. I'm comfortable referring patients to pRTF because I know they're not focused on just temporarily treating symptoms. They're helping give those we serve the tools and environment needed for them to succeed long term.
This program is particularly well suited for youth who have psychiatric diagnoses that require more support than outpatient care can provide, but who are not in need of long-term inpatient hospitalization. Benefit from a structured, closely supervised environment to stabilize, focus on skill building, and receive intensive therapeutic work. Because family involvement is essential, all youth in our program must also be receiving services through a community-based family therapy provider. This ensures that when it's time to transition back home, the skills learned here carry over into family and community life, preventing more restrictive placements or readmissions. We recognize that each child is unique and treatment is individualized. If you are considering referral, assessing whether outpatient community services alone are sufficient is part of the decision process. Referral sources often see meaningful progress in the youth they connect with our program. Children and teens typically show greater stability in their behavior and emotions along with a reduction in symptoms. They build coping strategies, mindfulness practices, and stronger relationship skills. Many leave better prepared to return to family life and community settings with lower risk of rehospitalization or placement in more restrictive environments. And because we work closely with families throughout treatment, supports are already in place after discharge to help sustain these gains. Increased stability in behavior, emotional regulation, and symptom reduction. Gains in coping skills, mindfulness practices, interpersonal functioning. Better readiness to return to home, family, life, or community settings. Decreased risk of hospitalization or more restrictive placements. Enhanced family connectedness. At LECOM Behavioral Health, our goal is not simply containment, but helping youth develop resilience and tools to thrive.
Our goal is always reunification and stability at home. pRTF is a tool to help get there. Because the program integrates and collaborates with community services, the handoff from residential to home tends to be more seamless. That reduces the risk of relapse or recrisis. pRTF gives the family a preview of what can be. The child receives intensive stabilization and skill building, all while working with community-based supports like ours, so the home environment can integrate the gains made.
As we're directly working with the clients before, during, and after pRTF, we're able to see major differences in the child's behavior post-pRTF. The positive behavior reinforcement model helps children learn what works. Daily routines, coping strategies, impulse control, in a place where staff are there constantly to coach, redirect, and reward. Also, the 24/7 supervision and structured environment allow for stabilization and therapeutic traction in the home with our team that might not be possible elsewhere.
To help determine if a youth may qualify and benefit from the program, we encourage you to first use our referral screener tool. When you're ready to make a referral, here's how. 1. Complete the pre-screener available online, and then, if suitable, complete the LECOM Behavioral Health pRTF referral form. 2. Attach a copy of the current psychiatric evaluation that supports the needs for residential treatment. 3. Send via email or by fax to 814-868-7793. If you have questions about suitability, bed availability, or the process, you may call 814-868-8286. We're here to support you every step of the way. To stay up to date on our program, including current bed availability, treatment outcomes, and upcoming enhancements, we invite you to join our monthly mailer. It's the best way to stay connected and informed. Thank you for taking the time to learn more about the LECOM pRTF and for the important role you play in supporting children and teens on their path to healing and growth.